Hi, I'm Dr. Lindsay Allen, and I wanted to talk a little bit about a procedure we offer here called endometrial ablation. This is a procedure that helps women with various menstrual pattern issues, such as heavy menstruation or painful cycles, or someone who might be having excessive menstrual flow and frequency of their menstrual cycle. An ablation procedure is a technique that allows us to either stop the flow altogether or at least lighten it significantly so that we have a great outcome. Any woman, first of all, who's experiencing a problem with her menstrual cycle, please tell us about it. It may not be just normal. We really want to be receptive about what's bothering a woman with her cycle and look into various options with how we can help. When we work up for an ablation, we may want to do some testing, such as a pelvic ultrasound to make sure there's no structural abnormalities within the uterus, as well as an endometrial biopsy. And I'll get into why that's crucial as part of our pre-evaluation for the procedure. What we're actually doing with an ablation is destroying the inner endometrial lining. We're going to be using one of four options. We might use heat via a gas or radio frequency electrode, or we might be using hot water, or there's an alternative with freezing technology called cryoablation. All of these techniques are considered endometrial ablation procedures, and we'll discuss with you at that time which one might be right. We do want to assess the size, the shape of the uterus, as well as make sure there's no structural abnormalities. For example, a woman with fibroids or an enlarged uterus may not have a good outcome from ablation because these can distort or kind of make the endometrial space less receptive to the technology of the ablation. And the other thing I had mentioned about needing the endometrial biopsy, this is crucial because when we destroy that lining of the uterus, we want to make sure we didn't cover up any potential cancer or precancerous area. When the patient comes to the office, we get her prepped and ready for the procedure. The nice part about offering this in the office is no downtime. You're coming in, we're getting you done, and you're off, on the same day, back to normal activities the following. So when you come in, we'll have you get prepped and ready with certain medications, one of which is medication for relaxing, as well as we give some pain medication through a sublingual tablet, as well as an intramuscular injection. All of these together will make patients very comfortable during the procedure. We'll let those medications kind of enter into the system, and then we'll come into the procedural room. In the procedural room, the physician will get the patient positioned, and then we'll perform what's called a cervical block. So this is using local anesthesia to the uterus and cervix. This is crucial for pain control during the procedure as well. All of these techniques combined really make for a comfortable experience, and patients will kind of leave saying, wow, I can't believe how easy that was. The ablation itself, depending on the technique, will take somewhere between 2 to 5 minutes, and that's where we're applying the either heat or maybe cryoablation technologies. This is what's destroying, ablating the endometrial lining. Once that's completed, the procedure itself is complete. We're making sure the patient is not bleeding heavily, her pain is controlled, making sure she's nice and comfortable and stable, and helping the patient on her way for the rest of the day. As far as downtime goes, there's very minimal. The medications you received in the office will probably wear off within a few hours, so we're kind of back to normal routine within just a few hours of getting home that same day. The only real restriction is we usually recommend no intercourse or tampon use for probably about 48 hours post-procedure, just to ensure healing and no infection risks introduced. And then we'll have you come back in for a post-operative appointment as well. The final thing I wanted to explain is that following an ablation procedure, the expected outcomes for the patient. Again, keep in mind, we're doing this procedure for heavy menstruation, painful periods, maybe a cycle that's too frequent. And so a successful ablation will mean that maybe up to half of women actually will see no more menstruation. Amazing, right? No periods, happy, great, we love it. So about half of women will have that amazing outcome, but 90% of women will have a reduction in their menstrual flow that is amazingly successful, meaning you'll go from that long, heavy, painful period to maybe just a couple days of spotting. It's very worthwhile. It really takes away the excessive, bothersome nature of these symptoms with a minimally invasive technique. We don't necessarily need to go to the operating room, and we can avoid things like hysterectomy. So last thing I'll finish up with is just reminding you, if you're experiencing the various symptoms that would be heavy or bothersome periods, painful period cycles, your cycles coming too frequently, these are not normal symptoms. Please let your physician know. We'll go over the options, we'll do the proper evaluation, and we can talk about possibly an endometrial ablation procedure. I look forward to speaking with you soon.